So holistic means combining different things, different approaches to get the best possible results, right? Because not everything can be solved only with one treatment. I don't want people who are very obese, who are coming to me and ask, do the magic.
Yeah.
Because we cannot solve everything, right? So I want them to do their homework first. Many people think liposuction is the solution of losing body weight. No, it's not. How much fat do you want to remove? You should not exceed a certain amount of fat, because the more you remove, the higher the risk get of bleeding, of thrombosis, etc., etc. But at the end of the day, it's nothing worth it if you're sick or something like that. So investing into your health is the best thing that you can do. And you have to set priorities.
Welcome to Inside Aesthetics, the world's most listened to podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, a facial aesthetic doctor, trainer and speaker with over 17 years experience.
And I'm David Siegel, an aesthetic entrepreneur and business mentor who's been working within our industry for over 2 decades. IA is a podcast aimed at educating aesthetic practitioners from around the world. The information contained within our episodes is general in nature and should not be used by the general public to make health or treatment decisions. You should seek the advice of a qualified healthcare professional in your country and have a bespoke consultation.
For our latest news, you can follow us on Instagram and TikTok, and now you can also watch our full episodes on YouTube and Spotify. All of our links are down in the show notes below. Now let's get into today's episode. Hey guys, welcome to another episode of Inside Aesthetics, the world's most listened to podcast for injectors and cosmetic businesses. Now, David, this is one of our last podcasts.
It is. It's one of my favorite ones I've been looking forward to the most.
We've still got drones flying overhead, so sorry if you can pick that up. Who is our special guest today?
We have got Dr. Mustafa Narwan, all the way from, well, you're all over the place. You've got a couple of different locations.
Exactly.
You're a plastic surgeon, and today we're going to be talking about biohacking and how you fit that into your practice from, like, I guess, an overarching integrative way, because, you know, it's kind of unusual, you know, to have surgeons looking at biohacking, all that kind of stuff. So it's going to be a really interesting discussion.
Yeah. First of all, buddy, welcome to the podcast.
Yeah. Thank you so much. Thanks, guys.
We know each other from the Allergan family. We met a few years ago, and it's been sort of great to get to know you. But we thought we'd do something a bit different for our listeners, because you've really leaned heavily into biohacking, but also living that lifestyle yourself, but also how you translate that to your patients.
Right.
Yep.
So first of all, tell everyone your background, what do you do, and where you base, because it's complicated.
Okay, guys, thank you so much. It's a great pleasure being part of your podcast today. So my name is Dr. Mustafa Narwan. I'm a German board-certified plastic surgeon. I'm originally from Afghanistan, but we moved to Germany, so I grew up in Germany. I have 2 clinics in Germany, but now also based in Dubai. So I'm back and forth between Dubai and Germany as a plastic surgeon. So I do a lot of body contouring surgeries when it comes to surgeries, especially high definition body contouring. That means shaping the body into a more athletic shape. And when it comes to face treatments, minimally invasive treatments. And we know each other mainly through Allergan, right? As trainers, international trainers.
Let's start off with, what do we mean by the term holistic medicine? Because, I mean, these terms can mean different things to different people. So what does it mean to you?
So holistic means combining different things, different approaches to get the best possible results, right? Because not everything can be solved only with one treatment, right? So that means the holistic concept, whether it comes to a face treatment or to a body treatment, is, first of all, doing a proper consultation to understand our patients, right? What are their needs? And then based on their needs, and also based on that, what we would recommend as physicians and as specialists, combining different things really to get the best possible result for them. That means holistic, everything under one roof. Yeah.
Right. And how did you find yourself interested in this area? Because obviously, coming from a surgical background, you probably didn't, get taught about these things, and it's also quite new and emerging. So how did the journey start for you?
I mean, usually as a plastic surgeon, especially as a plastic surgeon, you just do the last step, right? Yeah. So the first steps, like, for example, having a healthy lifestyle, if needed, using some devices, then you can handle some situations. But if it's very severe, for example, a lot of soft tissue laxity that you cannot handle by yourself or with machines, etc., then you need the surgery. So the surgery is usually the last step, right? But there are so many things that you can do previously. And that's the shift, not only in aesthetics and in plastic surgery, but in the whole field of medicine. What can we do nowadays to be preventive? And I see a lot of my patients having challenges, and I really try to motivate them to do things that they can do by themselves. And only if they cannot handle it by themselves, then surgery could be the tool of choice.
Now explain to everyone what you do on your Instagram, because this is one of the reasons we chose you, because you're kind of living and breathing this kind of way of trying to educate people about, you know, normal stuff, practical stuff, cheap stuff even. So why did you decide to lean into it and, you know, showcase it, I guess?
I mean, nowadays I use social media to communicate with my audience, but also with my patients. And the communication is not starting in our private practices. It starts much earlier through social media channels. So I really try to educate them before they enter my practice. So therefore, I talk about all those topics like biohacking, healthy lifestyle, about sports. So once they're in my clinic, I don't have to repeat everything. So they know my philosophy. Because I also want to attract this kind of patients to my clinic. I don't want people who are very obese, who are coming to me and ask, do the magic. Because we cannot solve everything, right? So I want them to do their homework first, and only if they have any challenges, then I can help them. And I start with the message through my social media channel.
Yeah, that's the same for injectors as well, right? You want to put out the messages for the patients that you want to hopefully attract to.
Absolutely.
Yeah.
Absolutely.
So what does a consultation process look like for you? So you meet a patient for the first time. How do you sort of, you know, they might come in with a surgical expectation, although if they found you on social media, they know that you're more than just about what you can do with a scalpel and suture. But how do you approach that conversation? How does the consultation process work for you?
So the consultation, I'm also a trainer, right? So I train other doctors. And one of my favorite questions at the beginning is, especially for injectors, I ask them, how long do you spend the first time with the patient when you see them the first time in your clinic? So the average, depends in which part of the world you are, is maybe 15 minutes, right? Which is higher than the average, right?
Yeah.
So my consultations, whether it's surgical or non-surgical, minimally invasive for the face, is always 45 minutes. Because the first consultation is a very important pillar of the whole procedure.
It's like a first date.
Somehow, right? The first impression,
Yeah.
right? The first impression. So we have to spend time at the beginning with our patients, first of all, to understand them, really to understand. It's not just about treating one single fold, for example, or wrinkle, really to understand deeply our patients, but also at the same time to educate our patients. Because maybe they have seen something on social media or they have heard something from their friends and they have the perception, I know exactly what I need. But at the end of the day, we are the professionals, we have learned it, and it's our responsibility as doctors really to educate our patients and really to guide them. And therefore, we need time. So my first consultation is about 45 minutes, taking the notes about their medical issues, what are they doing, what are their goals, and then I give them my perspective. And then before we start with the treatment, either injectables or surgery, of course, both of that should match.
Yeah.
The perspective of the patient and my perspective.
Yeah.
Because at the end of the day, of course, we want happy patients.
So how do you get to know your patients in that consult? Are you drilling down into nutrition, exercise, sleep, all this stress, all this kind of stuff? Do you actually ask them specifically on a pro forma, or does it come up more naturally and you're just sussing out who they are?
Right. So before they come to us, we send them a form. So we send them a form and we have some questions. Please, what kind of illnesses do you have? How often do you do sports? What kind of sports? How is your diet? So I prepare myself a little bit for the patient.
Yeah.
So to know, okay, who's in
gonna
front
walk
of
in?
me?
Yeah.
Who's walking in?
Yeah.
And then once they're there, I ask them again. And then we discuss, of course, also these topics. So when I get the impression, okay, this patient has already done everything that he or she can do by themselves, then what is their issue? And okay, what can we now optimize with treatments, with surgeries? But if I have patients in front of me who have, for example, some other medical issues that can also maybe solve the problem or at least improve if they're overweight, etc., then I tell them very honestly, look, I'm not the right doctor for you. You need other support. And also here, I'm connected also with other physicians who are experts in their fields, because I cannot do everything. I'm just a plastic surgeon, right? So then I guide them. I send them to other doctors. They do their stuff first. And then after that, they come to me. They're well prepared. And also in terms of, for example, when it comes to surgeries, to reduce the risks, it's very important that they take care of other things first before going under the knife.
Yeah. So what sort of risks do you think reduced when they go and do all of that preparatory work first? I mean, in terms of like, you do a lot of body contouring, so I'm assuming.
Exactly.
Yeah.
Exactly. I mean, for example, if somebody's overweight,
Yeah.
you should not do a liposuction. Many people think liposuction is the solution of losing body weight. No, it's not, right? How much fat do you want to remove, right? You should not exceed a certain amount of fat, because the more you remove, the higher the risk get of bleeding, of thrombosis, etc., etc. So that means I have a certain amount of fat that I can remove safely. When I exceed, then the risks increase exponential. So if they can lose the body fat by themselves as much as possible, of course, that will reduce the risk.
And I'm assuming that it, in terms of recovery is improved.
Absolutely.
So, wound repair, all those kinds of things. Yeah.
You prepare them really for the surgery, right? Especially when it comes to body contouring surgeries, the aftercare is also very important. So it's not just the surgery. I did the surgery and we are done, right? Yeah. Afterwards, they have to wear special type of compression garments. They have to do lymphatic massages, drainage, etc., etc. And when you start to prepare them, then you get also the sense of how ready are they really for the procedure. Because if somebody is not taking your advices already before the surgery, this kind of patient will not take your advices also after the surgery, right? And then you can really mess up the whole result at the end of the day, and then they blame you as a surgeon because you haven't done a good job. But I always tell to my patients, look, this is something that we have to work together. You have to do your job, and in those areas that you cannot manage by yourself, then I help you.
It's like a partnership, yeah?
Absolutely, absolutely. And that builds also trust with your patients, right? And trust is so important in nowadays, especially in our field, because there are so clinics. In Germany, my clinic is in Düsseldorf. So there is one road, and in every apartment or house or building is 1 or 2 or 3 physicians who are offering aesthetic treatments, right? And some patients, they just jump, right? Where is the cheapest offer? But if you take care of them, if you have a right communication, if they build trust in what you're doing, then they will stay also with you. And this is important. We want patients who stay with us for a long time.
Now, right at the start, we used the term biohacking. What does that exactly mean? And from a personal perspective, how have you gone on your own biohacking journey?
Biohacking is something that I'm interested by myself a lot, right? So not just only because of work, and I can combine it, right? So my passion with work. So at that moment, even my work does not really feel like pressure because I enjoy this topic so much. So biohacking nowadays, what can we do to be preventive, more or less, to have a long life, but a healthy life. So it's about the health span, right? We don't want to age 100, but to be sick the last 20 years, right? We want to age in a healthy way. And what can we do nowadays that is preventive for me or beneficial for me for my future years, right? And that could be different things. We already talked about it, right? So he's also very much into biohacking. So about nutrition, about supplements, about diet, about sports, about good habits, about recovery. So different things that you can do. And I take my audience, so I share also a few of my biohacking tips on social media, just also to motivate people to become a better version of themselves and to lead them and to guide them to every healthy life.
Jake's sick of hearing me talk about it. I think I'm aging him by talking about it. So
I still can't remember the name of your hormones, but you've told about 400 people what they're doing. I might seem a little bit, flippant about this, but it is super important. I guess I'm just going to take a bit more time. I'm just so busy. I need to actually focus on how am I going to do this? It's not that I should do it. Of course I should. It's more, how do I do it? Because I just, you need to diarize. It's like running a business. You need to make time for stuff. Otherwise it's not going to happen.
Well, look, when you're ready to do your first coffee enema.
They've already done one. How do you know?
Walk us through a day of what your health routine looks like, or a week. Sometimes you don't do the same things every day, but maybe look at an average week of how you take care of yourself.
Just the point that you said, of course, very busy. We all are very busy, right? We all have very busy days. But at the end of the day, it's nothing worth it if you're sick or something like that. So investing into your health is the best thing that you can do. And you have to set priorities. So, for example, my schedule, a few days during the week, because I start my day with workouts. So my schedule is blocked. So my staff knows no appointments at that time. It's my me time. So I set really priorities. So I start with my workouts in the morning.
What time?
So I start around 8 in the morning. Most of the patients in the aesthetic field, usually they work during the day, right? And they like to come in the afternoon. So I start a little bit later with my work. So in the morning, I start at 8 with my workout. It's either strength, cardio, HIIT workout, or I swim also a lot to prepare for some championships and competitions. So I do sports. Then I have my practice afterwards. And then I go to work. And the energy that I gain in the morning is so much worth for the whole day. Some people think, okay, if you do that at the beginning of the day, then you're exhausted, then you don't have any energy anymore. No, exactly the opposite happens. So doing it right in the beginning of the day, this is what I would recommend. Of course, everybody has another biorhythm, right? But I do it in the morning, then I go to work. Because after work, usually, going back home, of course, you have responsibilities with the family. You also want to spend time with the family. You don't want to miss that, of course. Once you're sitting on the couch, you will not stand. Then it's game over. You will not go to the gym, right?
Yeah.
So this is something that I highly recommend. A lot of my followers on social media, for example, they ask me, you travel so much. You have the busy clinic in Germany or 2 clinics. You work in Dubai. How do you handle that? And then sports, etc., etc., etc. I have my rhythm and my habits, and I try really to keep it everywhere. So even when we're here in Egypt right now, right? So I try really to focus on sleeping, right? Although we have dinners and even apart from last night, but still, I try to manage really to have a good, proper sleep somehow. I track that, the food that I'm eating, right? Even here, of course,
It's hard.
we don't.
It's hard.
It's really hard, right? But somehow to manage really to keep your habits, the good habits.
Yeah.
And it's important to build these habits. And until you have this habit, it takes time, 3 to 6 months maybe. And these 3 to 6 months, you will not see really results, but you will have a lot of pain. But it's worth it. But once you have the habits and you're not doing it anymore, then you don't feel comfortable, right? So it's important of building this kind of habits.
Yeah, I think it's important maybe to start with like small steps. You're not going to start off by working out 5-6 days a week. So you just say, okay, I'm going to start off by working out 2 days a week. I'm going to, start my day at 10 o'clock, 11 o'clock. I'm going to go for a swim. I'll go for maybe a walk. I'll do some body weight exercises. And then you start to feel the benefits. I know you're saying that like you might not notice like your body changing straight away, but definitely, you'll feel more energy. It's almost like a cheat code because you think you're giving up time, but you actually get more time back because you become way more efficient. Your energy levels are higher. So
yeah,
it's sort of like, it's a bit of a trick.
I noticed your Aura ring.
Yeah.
You've got an Aura ring on.
It's also orange, yeah.
Mine's missing.
How do you utilize this to kind of keep you on track, or what are you even monitoring on that?
So mainly for recovery, not for my workouts. So my workouts, because I'm not wearing it when I swim or when I do lift trainings, etc., because it's disturbing. And I tried also the armbands, but I like the ring more. I track it my workouts with a watch.
Okay, Apple Watch, is it?
It's Apple Watch, yeah. Just to see how my performance is. I really try nowadays not to be too much used to these devices.
Yeah.
Just to give me an objective feedback.
Yeah.
I really try to build also intuitive decisions to understand your body. And then when you double check, then you see, oh, it is matching.
I'm tracking, yeah.
I'm tracking. So that's important. But I don't want really to get too much used to it.
So when you mention recovery, what are you actually looking for? What are the parameters?
Mainly sleep. How long do I sleep? I'm focusing much more on recovery more than, for example, exercise nowadays. Previously, it was the opposite. And since I'm more focusing on recovery, I'm getting better in sports. So recovery is so important. And I unfortunately did not pay enough attention in the past, what I'm doing right now. So how much do I sleep? And of course, how is my sleep? I mean, you can spend 10 hours in bed, but your sleep can be very, very poor and very, very bad. And therefore, I use the tool, mainly for sleep, to measure my sleep. What about you guys?
For me personally, yeah, I mean, I make sure 7.5 hours is like that magic number for me. It's also like trying to be disciplined with getting to bed at the same time.
Right.
Because your body gets into a cycle. And if you start to disturb that, because as you said, it's not just around the number of hours that you sleep, it has to be like restful sleep and making sure you fall into that phase where you're getting the most recovery.
Right.
Yeah, so for me, sleep's a big one because there's so many distractions. You know, your phone's going off. It's definitely hard. So for me, yes, recovery is a huge one. Like even just things like drinking enough water during the day, like simple things. You know, you can get busy.
Yeah.
Like even whilst we've been here, it's difficult, as you said, when you've got outside of your controlled environment where you know where your gym is, the weather, you know, your own, even sleeping in a bed that's not yours. Like, you know, scientifically, and you can tell me you're the doctor, but from what I've read, that like even when you're sleeping in a bed that's not your own, your brain doesn't switch off because it doesn't feel safe. It knows you're in a foreign location, so you kind of don't hit that same level of deep sleep because you're not totally relaxed.
What I'm doing, for example, I have my pillow that I take with me. Yeah, so it's a very small one, so I roll it because I know in the hotels, you know, you have some totally different, you know, unpredictable. And also to cover my eyes, to keep it dark, right? Sometimes I have also blue light filter glasses that I wear in the evening just to get into the mood. Okay, now it's evening, now it's time to rest and to sleep. Yeah. The other thing about all those tools, for example, also the blood glucose measurement long term, gives you nice feedback because sometimes your own subjective impression could be completely wrong. But then when you do something, when you eat or drink or whatever you do, right, and then you see it black on white, then you understand, okay, is this kind of food, for example, beneficial for me or not, right? Because there is not the customized way of eating, for example, right? The food which is good for me does not have to be good for you or for you, right? So to know exactly what is the right thing for you, therefore also the tools are very good.
So have you been wearing a monitor, or was that you did it in the past?
In the past, yeah. I'm not doing it all the time, but sometimes I do that. For example, when I'm on vacation, then I do that. Sometimes I have also some cheating days, right? I just want to see what is happening in my body. For example, the way how I eat.
That's actually why I bought the Aura Ring. You know, I do want to start sort of being a bit more motivated about this, but I want to understand my body first. So I just put this on. I was like, well, how much do I actually sleep? Because my sleep it's not long. I'd probably sleep about 6 hours and I'm done. I just can't sleep longer than 6. But if it's good quality, that's okay for me. It might not be good for you. So just sort of understanding like what's my normal, and then I can start working with that. Well, if I'm a night owl or an early riser, then I need to plan my exercise, for example. So that's my first step, to understand what does my body like and what am I actually doing. There was one time I came home from America about 4 months ago from an Allegan tour, and I was absolutely wrecked. And this told me, you need to stop. And so it's pretty intuitive, but you know, it's nice to know that what it says is what you feel. Like it's sort of understanding your body better.
The hours after midnight don't count the same as the hours before that.
Sure.
So even if you're getting 6 hours sleep, your body isn't getting the same rest after midnight. I mean, maybe you can talk to the science more, but that's what I've read, that, you know, the hours after midnight are not as useful as the ones before me.
Yeah, but and also especially those long flights where you cross a lot of time zones, really. It destroys you. That really destroys you. And this is really challenging. So for example, for me, I have 2 hours, depending on the season, 2 or 3 hours time difference between Germany and Dubai. And I fly very frequently, but even the 2 hours is really bad.
How do you combat that? Do you take things like melatonin, and what's your process for dealing with jet lag?
So I'm most of the time in Dubai, and when I travel for a short period of time, I try also to be in the other countries where I am in the same time zone.
Yes.
So for example, when I'm in Germany, I still keep, for me personally, the Dubai time zone.
Yeah,
that means I go earlier to bed.
For a short time.
Right.
Right.
So I go earlier to bed.
Yeah.
And then I wake also earlier.
Yes.
So I can do all my stuff. So I really try to keep the time zone where I stay most of the time.
Yeah.
Then it's much easier for me.
It doesn't always work, but as soon as I get on the plane or even a few hours before, I turn my clock to the local time that I'm flying to,
right,
and I'll eat and live by the new time zones. If they're offering me food on the plane,
right,
as I get on, and it's like 2 a.m. local time, well, I'm not going to eat because it's just going to prolong my jet lag.
Yeah, but you guys, I mean, Australia is on the other side of the world. Wherever you go, right? It's.
I mean, our trip over here, we had the 13.5-hour flight to Dubai, and then we had, the 3-hour flight from Dubai to Egypt. But even like going to America, like anywhere we go, it's like there's a massive difference. Even from one side of our country to the other, there's a massive difference.
Japan's good. It's almost straight up.
Yeah.
So Japan's a good destination if you're from Australia.
Yeah.
But it's 15 hours flight, right?
Yeah.
Yeah.
Or 9
exactly.
hours.
Yeah.
Hey guys, sorry to interrupt your podcast. Just a quick message about our Patreon and how you can support us as a podcast. So David, what is Patreon?
So Patreon is an on-demand subscription service that allows you to access our global community of practitioners, business owners, and essentially it's a place where you can come together, get positive support, advice. Whether you're a beginner or an experienced KOL, there is a place for everybody.
Yeah, so if you download the Patreon app, search for Inside Aesthetics, there are two main options to subscribe. You can become a free member where we can communicate with you, share our news, involve you in competitions, etc. Or you can become a full subscriber for 50 Australian dollars a month. And there you get access to the WhatsApp community where people are sharing and getting advice. But also within the Patreon app, David does a lot of business coaching and mentoring. So I think you've drilled down to various topics that have cropped up that have been communicated in our WhatsApp group.
I mean, just today we recorded some content. It's quite a nuanced space, and the challenges that business owners and practitioners come up against in this space is quite difficult to get advice on. So always happy to share my knowledge and all of my mistakes and lessons learned along the way.
And then I, of course, tackle injectable content. I often involve patients or talk about new products, anatomy, and all that good stuff. So if you like what we do, consider subscribing to our Patreon. Now let's get back into the podcast.
So what about supplements? Talk to us about your supplement regime and what do you think has the strongest evidence for, for health, longevity?
So I take a few supplements which are really somehow scientifically proven.
Yes.
In terms of safety, in terms of benefits.
There's a lot of snake oil, isn't there? There's a lot of people who say things that it's not true.
So many things on the market, but what do I really need? So what I take, protein. Yeah, because
Which kind?
Whey protein. I take whey protein. I found one from Germany, which I tolerate very well. So I tested many different types, but the way how they process it is very important, for example, not to get bloated or not to have any skin issues, etc. So I found one which is very good for myself because I cannot eat that much of other stuff to really reach the amount of proteins that I need per day.
So you've based it on your body weight and your sort of a calculation?
Yeah, and depends on how hard I have my workout sessions during the day.
So you're taking like what? Like 1.5
1.5 to 2 grams per kilogram.
Yeah. Okay.
So whey protein, then creatinine.
Yeah,
because this is really
it's like a miracle supplement.
Right.
Yeah.
I mean, it has so much benefits, not just for your physique.
Even your brain.
Exactly. Sleep, brain, focus, everything. And this is really scientifically proven. So I take creatine once a day, 3 to 5 grams. And you can take it continuously, right? Days back or years back, people took it just for a short period of time, especially the bodybuilders. And with big doses, then you have some side effects. But with 3 to 5 grams per day, you are safe. So then I take magnesium. Yeah, just for muscle recovery.
Which type of magnesium?
Oh, there's a lot of different types, isn't there?
There's a lot of arguments
I think
about
7, I guess so. But the one which I take is a liquid one. So you have it as a tablet or the liquid. So the liquid one, I'm not sure exactly what type it is.
Is it flavored or does it taste like metallic?
No, it is a little flavored. It is a little bit flavored, yeah. So I take just magnesium. What else do I take? Vitamin D, of course.
Yeah.
D3 with K, right?
K2?
K2, right? And collagen, actually. Collagen, for a long period of time, I was not really sure. I thought, okay, what?
I know, it's very controversial, isn't it? Yeah, it
was. You take collagen, right? And it goes through your digestion system. It goes to your liver. And how should the collagen know to go to your joints or to go to your wrinkles? It's destroyed. It's at the end of the day, it's a protein.
Amino acids.
Amino acids, right? But nowadays, we have science behind it, right? So really, we have science that it is beneficial. And when it comes to all those supplements, we take it, we trust the science, but you do not see the effect immediately. In a few things, you recognize it. For example, in magnesium, you recognize, okay, my recovery is faster, or also the benefits of creatine. But when it comes to vitamin D or when it comes to collagen, etc., you do not see it immediately. And this is the preventive medicine. That means you're doing something that will be beneficial for you on the long term, but you will not see it quickly. The same thing that we have with injectables, with biostimulators, for example, right? The biostimulator is not giving you immediately the result. It takes time. And also the collagen that is produced after that stays for a long period of time. And this is something that you have to understand, And this is also, we should also use our voices to spread the word, also to educate other people to understand, okay, this is what I have to do. I will not recognize it immediately, but on the long term, it's beneficial for me.
Do you add like a banana or anything? Because like collagen's not a complete protein, so you need like like a tryptophan with it. So do you add anything?
To my protein, you mean?
Yeah, no, to your collagen.
To my collagen, no, nothing. I just put it as a powder.
Yep.
I just put 2 spoons into my coffee in the morning. Usually just 1 coffee in the morning. The latest one at 2.
Yep.
Right? Because also this is proven, right? Even those who say I can drink a coffee and then I can go to bed. When you measure, the sleep is not good. The quality is not good. So I really try to have my last coffee not closer than 8 hours to my bedtime. So that means which is around 2. But usually I have just 1 coffee in the morning and I take it just with, and I put my collagen into it as a powder.
Now, I guess looking ahead, how would you be able to adapt this and make this even more formalized in your clinic? Or maybe for listeners thinking, wow, this all sounds so awesome. I want to do this for my patients. What advice can you give them to sort of integrate this into their clinics?
You need the knowledge, right? So if you're a doctor, I say, I just want to start, okay, you need the knowledge, right, in biohacking, okay? How is it really working? And nowadays we have so many things. I grab most of the things through podcasts, for example, right? A lot of information, a lot of books. So that means you have to educate yourself first in biohacking until you offer it to your patients. And then it's important to have a good circle of specialists. So I work, for example, with dietitians, with coaches, with personal trainers, gastroenterologists, diabetologists. So when patients are coming to me, or GNY, gynecologists, right, in terms of hormone replacement therapy for women, etc. So during the consultation, when I think, okay, this person in front of me needs some advices from them, then I connect them. I tell them, look, go there, and do this and that. So therefore, you need people around you who are specialized in this field, because you cannot do everything by yourself.
Yeah, I think it's important to say to the listeners as well, one, the information about supplements isn't advice for you to start taking, it's do your research. But also you don't have to be an expert. You know, you're not a life coach, you're a doctor.
Right.
And you get other people who have that specialty to help.
So don't try and do everything. Can I ask you a controversial question?
Sure. We all know that GLP-1, it's being used widely, it's a peptide, but there are other peptides. There's a lot of controversy around, certain other peptides. Do you use any other peptides yourself?
No.
Okay. And why is that?
Do we have really science behind it?
Good question. Yeah, I don't know.
I think not really. I mean, peptides they have a lot of potential, right? A lot of potential. So I know, for example, for peptides, for if they have any joint problems, right? Really injecting it into the joints, we see a lot of benefits in terms of recovery. But honestly, I'm not really into peptides and how will it, or what is it doing when I take it, right? So I need really somehow science backup before I start with something. And because that what I saw so far is not convincing me.
The analogy for me is a little bit like exosomes. It's like, sounds promising. The science is kind of there-ish, but it's not specific enough for me. It's like sort of throwing a peptide or an exosome at a problem and hoping something will work.
Right.
Yeah.
I don't think I'm not also disagreeing. You've obviously seen benefit.
I have like huge benefits, but I understand, I mean, there's also the commercial side of our industry too. And so like to do like, a randomized double placebo controlled study costs, millions and millions of dollars. And unless there's going to be a financial return for said pharmaceutical company, then who can afford to do that? Especially when you can't patent an amino acid.
Exactly.
And that's the challenge, is that how do you actually prove it where it becomes, certifiable, heavy duty science, when no one's got the money to actually, there's no motivation to actually do that research. So we're kind of in a tough situation.
Yeah, and the other thing is, only because something is not scientifically proven, it does not mean that it's not working, right? In terms of polynucleotides, peptides, exosomes, etc., etc. It does not mean that it's not working, because most of the things are not proven scientifically, right? And it needs time, but I'm happy that many doctors, not only in the aesthetic field, are focusing on biohacking, right? And for sure, we will have also more science backup for this kind of peptides, definitely.
Awesome.
Yeah. What's the one myth or thing that you think patients get wrong most? Like, what do you...
Fake news.
Yeah. Well, like patients come with preconceived notions about, oh, I should be doing this or I shouldn't be doing this. Is anything that comes up commonly for you?
I mean, nowadays we do also a lot of injectables, right? And what we are faced is they're coming to us and tell us, definitely I don't want to have fillers, for example, right? But if you have volume loss and you want to replace volume, then you need volume, right? But they have heard that maybe it stays forever or it migrates, it creates all those complications. Of course, with everything, even with just taking blood from the arm, if you don't know how to puncture the vein, you can cause problems, right? So it's so much dependent on how treatments are done, the injector by themselves, the products that they're using. So this is something that most of us are facing globally, right? That people are afraid, oh, I don't want it, right? And again, here, the communication skills, right? From the beginning, understand your patient and educate them, right? Tell them, okay, in your case, when it's needed, then it's needed to do,
Final question. If you weren't a doctor, you weren't involved in medicine, what do you think you'd be doing with your life?
If I were not a doctor.
Yes. What would your other career choice be if you hadn't fallen into medicine?
Somehow into arts, definitely into arts, because I love art, to create things by myself with my own hand. That was actually also, as I told you, one of the reasons I became a plastic surgeon, right? So arts, architect. I liked really architect and sports. Maybe a professional career as a sport guy. So I was a swimmer as a kid. And then I stopped for a very long time, but now I'm competing again, even at my age. And I have some goals which I want to hit. And I think nowadays, especially with biohacking, healthy lifestyle, it's even possible. So the career does not have to end with 30, professional career. So this is my goal. But I think being not a doctor, that could be something that's...
Like, joking aside, you've got Afghani heritage. You could potentially go for the, you could qualify.
Yes, I could really qualify for big events through my nationality. So I have 2 nationalities. But anyway, if I go to a big event, I also want to perform, right? I don't want to have, okay, he just got the ticket because, no. If I'm there, then I want also to push myself as much as possible and also present the country in the best way I can.
Fair enough. Well, mate, it's been great to have a nice catch up at ICCE and learn a bit more about you. Thank you for sharing your knowledge.
Thank you so much.
When are you flying home?
On Sunday.
Okay, so
back to Germany.
You're doing more trainings in clinic tomorrow for Egyptian
Exactly. So
injectors.
I have some treatment for injectors here in Cairo. On Sunday, I will fly back to Germany. Then there's another event in Italy, and then back to Dubai, another event in between patients. Traveling, but really try to keep my habits and my rhythm. So for the injectors, last question, what are you thinking of the Egyptian injecting sort of circuit? Like, is it advanced? Is it behind? Is it still learning? Like, just be honest. What have you observed? I mean, the market everywhere is from here to here, right? It's like you can buy a t-shirt for just €2, right? But you can buy a t-shirt also for hundreds of euros, right? And also here, it's a huge market. I mean, it's a huge country. Only here in Cairo, more than 20 million people live only in one city, right? And of course, a lot of injectors and a lot of different qualities. I saw some very talented doctors, very educated in terms of how they do their injections. But I saw also some doctors who are just doing something copy-paste all the time, but they do not improve. And I try really to guide them or to share my experience with them, right? It's not teaching, just sharing with them, okay, what they can do also to elevate their skills. And that should be our goal.
Awesome. Fantastic. Well, we look forward to seeing you at the next conference.
Thank
you very much for the podcast.
Thank you so much, guys. Thank you.
Thank you very much. Thank you so much.
See you later.
Bye.
We hope you enjoyed that episode, guys. To stay up to date with our latest news and episodes, follow us on Instagram, and we're now on TikTok.
You can also now watch our full video episodes on YouTube and Spotify. So if you like what we do, please give us a like and subscribe. Please also consider joining our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, hints and tips videos, bonus podcast content, and more.
All of our social links, Patreon, and contact information are in the show notes below, and we'll see you in the next episode.